going to tell you a little bit about palliative care and universal health coverage. Charities such as the Worldwide Hospice Palliative Care Alliance are campaigning to ensure that palliative care is included in universal health coverage. Universal health coverage is a package of healthcare, much like what we have in the UK with our NHS. The whole country pays their taxes, and this goes into funding a healthcare system that is available for all, even if they cannot pay into that system because they are too ill to work. Palliative care is a part of our universal health coverage in the UK. But what is universal health coverage? This is how the World Health Organization defines universal health coverage. Universal health coverage, UHC, means that all people and communities can use the promotive, preventative, curative, rehabilitative and palliative healthcare services they need of sufficient quality to be effective, while also ensuring that the use of these services does not expose the user to financial hardship. Sadly, palliative care is getting missed out on much of the work into universal health coverage packages. Healthcare should be available to all, including palliative care. People should not be suffering needlessly, living and dying in pain because of a lack of access to palliative care services. Where palliative care services are available, people should not be forced into financial hardship just to afford the care they need. Living in the UK, I have access to the fantastic National Health Service, which provides healthcare free at the point of use. We have great access to palliative care services. But did you know that most hospices are actually charities? We are a developed, rich and Western country, and yet even our government will not provide the full funding for hospice and palliative care services. Most hospitals and some communities have NHS funded palliative care teams, but most actual hospices themselves are charities. Some even receive less than 15% of their funding from the government. That is absolutely shocking. Palliative care services and hospices should be fully funded by our government. What example are we setting to developing countries when our government won't even fund the full cost of palliative care services, thus not showing the true benefit of palliative care? I live in the UK where I have access to the palliative care services I need. I'm supported by a hospice. I have access to the pain relief and other drugs I need to manage my symptoms. I have a home care package, and I have the support and care I need to remain at home with my family and have my symptoms managed. I will not die alone, in pain, suffering horrendously, and my family will not be left to carry the burden alone. Palliative care is a basic human right. I implore all governments to ensure that palliative care is available freely to all who need it. Thank you for watching.